The Qimpro Platinum Standard for Healthcare was introduced in 2004. It is a great privilege for me to announce our 2017 Qimpro Platinum Standard for Healthcare is Dr. Samuel Mathew.
Dr. Samuel Mathew Kalarickal is a role model cardiologist who is referred to as the father of angioplasty by the medical fraternity in India. His patients are deeply touched by his assurance, his humility, and his care. Dr. Mathew is an astute clinical cardiologist. His specialization is coronary intervention, especially highly complex interventions in coronary angioplasty and stenting and carotid stenting, rotational, I hope I get this right, atherectomy, laser-assisted angioplasty, and various other new modalities, all in the interest of patient care. Dr. Mathew earned his MBBS degree in 1974 from the Government Medical College in Kottayam. He got his MD from Stanley Medical College, Chennai in 1978 and his DM in 1981 from the Madras Medical College in Chennai. After starting his career in India, Dr. Mathew moved to Medistra Hospital, Jakarta, and later to the Royal Hospital in Muscat. Thereafter, he joined the Emory University, Atlanta, where he was groomed by the father of coronary angioplasty, Dr. Andrews Grutzig, quality by design. Dr. Mathew has been practicing at the Apollo Hospital, Chennai, since 1985. I think that's where I first met him, in the US when he was first invited here. He is credited with performing over 15,000 angioplasties. My God. It's a record in South and Southeast Asia. He's also the first Indian cardiologist to initiate various new techniques, such as angioplasty with percutaneous bypass coronary stenting, carotid stenting, rotablator atherectomy, amongst others. An evangelist, Dr. Mathew has initiated coronary angioplasty programs in numerous hospitals in India. Also, he has trained many interventional cardiologists in India, in Southeast Asia, and also in Australia. Further, he has worked with 136 catheterization labs in 12 different countries. Okay. Teaching angioplasty. He believes that knowledge is no knowledge unless it is shared. Dr. Mathew is the founder, convener of the National Angioplasty Registry of India. This is a forum for interventional cardiologists to learn from each other, streamline the standards of procedure, and facilitate implementation of international standards. A researcher, Dr. Mathew has 4 patents. Not 1, not 2, not 3, but 4 patents. Electronic algometer, jugular venous pressure scale, temporary stents, and marker guide wire for QCA analysis, whatever they mean. They obviously are very impressive. Padma Shri Dr. Samuel Mathew, a man with a mission, a man with a vision. We salute you, Dr. Mathew. Our Qimpro Platinum Standard 2017 for healthcare. Ladies and gentlemen, Dr. Mathew.
May I request Dr. Farooq Udwadia, our Qimpro Platinum Standard 2016, and Mr. Suresh Lulla to present the award to Dr. Mathew. I'll take that.
Good evening, everybody. I sincerely thank the panel of judges, the jury, and the management who have chosen me for this prestigious award. I say this because I saw the list which is published there, the previous award recipients and today's recipients. I feel humbled in front of all of you. After returning to India, after training, I come into a minefield which was totally dominated only by surgery. The only standard of care for coronary artery disease was only surgery. I come with a vision and a mission to start something new. Talking about a balloon can open the blockages came up with tremendous amount of resistance. People found it very difficult to believe it can happen. And not only that, we all knew, even after opening these blockages, some of the blockages can fall back and close. That was not small. That was about 4 to 5%. And we had various other limitations those days. It can happen after you go back home. Then what will you do? How will the hospital contact you? There is no way, because our P&T telephones hardly works, and if it rains, it never works at all. And there were no mobile phones. So most of the days, we spend the nights at the hospital, usually in the cath lab floor, because that is the fastest way to get re-access to the patient and treat them. Because as I said, if it closes, we can lose the patient's life. We can reopen and save the patient. This is the days we went through. It has been a long and rapid journey after that. We went through a lot of revolutions in treatment of cardiology, in cardiology. The stents came in, which saved the patient from these emergency situations. Refinements in stents came to drug-eluting stent, and even to stents will disappear in a period of time. In addition, there were, as Roger said, rotablator. We are using a device which rotates at 200,000 RPM inside the moving coronaries. When the heart is pulsating, a fraction of second deviation can cost somebody's life. But that can save hundreds of lives if trained and properly used. These revolutions change the outcome of coronary artery disease and treatment. Today, the bypass surgery has drifted to a second level of treatment. Only when angioplasty fails, we advise surgery, or it cannot be done. These revolutions has a dampener now. Thanks to our Prime Minister's political decisions, new devices stopped coming to India from this year. And newer turmoil is happening in healthcare. Those of you who have read about the Karnataka Medical Establishment Act, which has been introduced, will destroy the medical profession and the hospitals. There are several agonies. There are issues which all of us face as doctors, which all of you know about it. Today, we can even replace the valves percutaneously, which was only possible by surgery. We can even replace the old surgical valves with new valves percutaneously. it is heartwarming and a matter of honor and pride to see India today is no less than any of the best in the world in terms of skill, technique, and quality care. We are able to upgrade our skills constantly and continue to train the newer generation to take over from us. I would like to thank my family, my children, and my wife for the sacrifices they made to allowing me to succeed. Still, they tolerate me and continue to live with me, especially my wife, my colleagues who supported me wholeheartedly in all my endeavor. Finally, I thank you all, and all my patients who trusted their heart with me. Ladies and gentlemen, to say the least, it has been a fascinating journey. Thank you very much.